how do drug and alcohol rehabs work? Now that is a good question. And the idea, first of all, is abstinence. So we get the person out of their regular routine and the regular environment, and they stop using the drug of choice. Of course, if it's something with severe withdrawal syndrome, they might get on an opioid replacement therapy like Suboxone or Methadone. If it's alcohol, then they're put on Valium-like drugs for a few days and then tapered off of those. So once a person has gone through the first stages, which is kind of like a detox, then they're truly ready now mentally to approach the bigger issues, and this is where rehab really helps. Rehab involves living your life in a structured organization where there's a regular routine, a healthy routine, a schedule to every day. It's supplemented by both lectures, by small group sessions, and by one-on-one sessions. To explore what are the things that worsen my addiction, what are the things that make me crave using drugs, what are the things that I can learn from other people, other situations that they've experienced, what were their stories, I can learn from their stories as well. Those are the main things. They equip you with skills to deal with life stresses, to avoid triggers that can lead to a relapse, how to ask for help, to learn how to be open and candid. A person is unlikely to get help for themselves and really reap the benefits of rehab if they're closed off or wearing a mask. And the professionals, the true professionals out there, can read right through this, as can other users who are experienced with addiction. So a person needs to lose their ego, they need to be open and honest in a rehab, they need to be willing to look at themselves, be humble, laugh at themselves sometimes, and enjoy life in there as well. It's a comfortable environment, it's a loving environment, even though it can be difficult at times. But this is generally what goes on behind the closed doors of a rehab facility. Lastly, they could be put into a transition program where they're living at the rehab and then returning to work, but living in the rehab. So this allows them a slow transition where they're buffered from the stresses of life. They're not in their normal routine, which can predispose them to a relapse. That would be the ideal rehabilitation center. So detox followed by rehabilitation and then a transition program.